everybody, it's Cookielu in Arizona. How are you doing? I hope you're all doing well. It's been a while since I've been here to say hello to you. It is the 27th of August. I think the last time I spoke with you was June 30th. It's just before the 4th of July weekend. So what have I been up to? Well, I have been to the, well, let's kind of go back just a little bit. I'm going to give you an update on my spinal radiofrequency ablation possibility. Well, that's been ruled out for me. I am not going to get that because where they were shooting the injections for in the branch nerves of the spinal cord is not the area that is causing pain signals to my brain. So what I'm going to be undertaking is radiofrequency ablation is completely out of the question, and they're going to have to go into another area of my spine where there's a larger nerve or something that shoots off the edge of the spinal cord. They're figuring that that's probably where they need to go, and the only thing they can do to treat that pain center is using a steroid injection. So I guess I'm going to be doing that to get some relief on my back. I'll probably be going, I think, around the 7th of September. And I do have to go off my blood thinners again in order to get that injection. So I'm going to do it. I want to get rid of this pain. I want to be able to move a little bit more. Regarding my experience with Dr. Robin Blackstone, the bariatric surgeon that I wanted to see, if you check my last video, update on Cookielu, that I did in June, it'll explain a lot about why I'm interested in seeing her and what she does. Everything in that video that I had found on her YouTube video that she had made, everything that she talked about on that YouTube video is what she pretty much covered at the seminar. It was close to 3 hours. She was a wonderful doctor. She just said that there's lots of things that she wants to explain to us about different weight loss surgery options. However, she said she wanted to start explaining why we're big. And a lot of the things that she discussed is what I mentioned in my prior video, update on Cookielu, so you can kind of go back and hear what I have to say about that. I took a lot of notes when I was there. I was just scribbling down. I have about 5 or 6 pages of notes. Everything that she said, yeah, about why we regain after a diet, whether it be a self-imposed diet or whether it be a weight loss surgery diet. Basically, it's the brain. We get that head hunger that we keep complaining about, and the brain is 100% fat, and it takes 100 grams of sugar every day for it to run itself. And its sole purpose is just to feed us and to nourish our systems and to help the systems work. Fat cells are the same. They're storage, little fat lumps of storage containers that are filled with lipid, which is fat. And when they start getting smaller, when they're big and they start getting smaller, they get a little upset that they're starving and they want to be fed more to plump up again. So signals from both those centers, sensory centers, whatever they might be, are very strong. They're very strong, and they will nag and nag and nag until we succumb to the cravings and the desire to eat even when we're not hungry. The brain and will allow us to lose weight, but then after a while it starts to sense that this isn't a good thing. You know, it goes through this famine BS that is actually a fact. That, oh, she's not eating, we're losing calories, we're losing pounds, something's wrong. No, it wants to retrieve those lost pounds, and it's going to nag us with images and cravings and thoughts in our brain to really help us, force us to eat and to gain weight again. So that's pretty much why that happens, is when we lose weight, we can't hold it off. We can't keep it off. So it's frustrating. And she also spoke about different things, about why we're big. A lot of it, a good portion of it is DNA. It's our inheritance. Even if our parents per se are not fat, there's usually somebody in the DNA family line that might have been obese. It's the way we're raised, the behavioral of eating in our family table, and how we're fed then, the types of foods that were introduced to us in our childhood. The ritual of eating, the memories of eating when you were a kid and it was a happy time. And I mean, I personally myself can identify every loving relative with a specific dish, a meal that they've prepared for me. And I was going to tell you something. I'm going to confess this. And it was really a shocker for me. I was in the bakery getting some cookies. I was going somewhere and I was getting a little thing of cookies to bring as a house gift or whatever, dinner offering. And I saw the baker come out, and he had this huge square cream cake with nuts all around it. It was a birthday cake. And I went, oh my God, I remember that when I was a kid. I said, those are the birthday cakes we used to have. You know, we had birthdays in my family, and I used to get those for my kids, you know, when they had birthdays. And the cream cakes with the rum on the bottom, and the cannoli cream in the middle, and the pudding in the next level, and the nuts wrapped around it, and the pretty roses that they make. I got all excited over a frickin' cake. I mean, I literally felt my heart jump. I says, wow, that's the obese mind doing its thing. You know, the food addicts rush, you know, and it's just how we're made. If we're an obese person, it's pretty much what we're made of and how we respond, and why we're big. That's why we're big, because those feelings that we wrap around food are so inviting and electrical, stimulating. So she also talked about SUVAR gene, SUVAR, turns off our ability to burn fat, and that stems from eating sugar. So every time we eat sugar, our ability to lose fat just says no. And on the environment, we have a sensitivity to smells, and most of us, like if we smell something delicious cooking, we'll literally salivate and go, oh my God, that smells so good. I got to get some of that, and I got to get it now, and a lot of it. That's how our brain will react to certain smells and tastes and textures of foods that are so tasty and delicious. We want more, we want more, we want more. So that's another thing she talked about. The brain will always make us hungry. Hormone signals is a hormone called GLP-1, which will kick in when we're eating to let us know that we're satisfied, but we need to eat slowly, chew our food well, which is what we all know, and give that hormonal gene, that hormonal signal, at least 20 minutes to kick in. So if we're going to be eating our food within, let's say, 7 to 8, 9, 10 minutes, and then we're boom running out the door, or we're eating on the run, we're really not giving that meal the chance to process properly for that signal. Hey, we've had enough, we're full. It doesn't kick in. We don't give it enough of time to kick in. Fat people get more calories from what they eat than slender people do. It was a little confusing for me to understand that, but like if I eat an apple and a skinny person eats an apple, I'm going to get more calories out of that apple than I'm going to hold more calories on that apple than the skinny person does, because they're going to burn it up quicker than I will. So my calories store, hers burn up. Thank you for that. Inside our intestines is a bacteria, a virus, and all kinds of things called archaea, is what it's called, archaea. And it wrings all the calories out of our food. And sometimes if that's not working properly, we can have some intestinal upset. What else? God, she talks so much. The basal metabolic rate, BMR, how we have brown fat in our body as well as yellow fat, and the brown fat is the good fat. It helps us to burn up the calories. It burns energy, so people who live in a colder climate have more brown fat. Well, I live in Arizona, so I don't think I have very much of that. Okay, what else? Oh, drugs that we're taking, some medications that we're taking can have a big influence on our weight loss or lack of. So guess what? Cookielu went home and she looked up the medications that she's taking, which is the warfarin blood thinner and metoprolol, which is a high blood pressure medication, but it also helps irregular heartbeat, afibrillation, which is what I have. And those are pretty much the only drugs that I take. And both those drugs are affiliated with, guess what? Weight gain. And neither one of my doctors, the heart doctor, the damn PCP doctor, none of them mentioned that to me. And I asked them repeatedly, ever since I had this weight loss surgery, I'm having a lot of trouble losing weight, keeping it off, not regaining. I'm working my butt off, and I get really frustrated, and the frustration causes me to go off track. Well, it's not the medication. You just have to work harder, and you have to watch your calories. You have to exercise more. It's me. It's me. Well, guess what? It's not really me. It's not all me. Not all me. Because I found out that although warfarin, which is the blood thinner of generic of Coumadin, I'm trying to talk fast to get it all in. When you look at the side effects, it has everything under the sun, even some scary gangrene and bleeding out and dying from hemorrhaging. I mean, everything under the sun that can scare the hell out of you for not wanting to take this medication is there. Weight gain is not in there at all. But if you look at askthepatients.com and referencing to Coumadin, there was 27 pages, over 400 reviews that were commented and entered on the site. And just about every one of them said that they gained weight, lost appetite, but gained weight, and they have strong inability, no matter what they do under the sun, they can't lose it. Anywhere from 10 to 65 pounds. Mostly it was in the 30, 40 pound range. Most of the people that were doing the comments regarding weight gain and warfarin were a lot younger than me. They were in like anywhere from 23 to maybe 40, 45, like that. There was a few people that were in the 60s. One woman was 70, and they were saying that they had gained some weight with warfarin and was unable to take it off. Now, my problems with my VSG started when I went on this medication. I mean, I lost weight. I mean, I gained 15, 18 pounds when I went off track over the course of those years when I first had my VSG surgery. And I was able to lose the weight if I put my mind to it, exercise, whatever. But I couldn't go below a certain level. Now, that could just be the VSG is known to do that. It'll just allow you to lose a certain amount of weight, and then you level off, and you either have to have some kind of revision to lose the rest of it. So I don't know. I don't know if it's the warfarin. I don't know if it's the VSG surgery. Also, the other drug that I take, metoprolol, which is for the AFib, that also it's listed that you can gain some sudden unexpected weight with that as well. So those are problems with me, why I'm probably not continuing to do very well with the VSG. I really think it's pretty much done everything that it's going to do for me. So when I did speak to her after the seminar, and I told her that I had the VSG some years ago and I kind of leveled off, and she suggested, well, you might need to have a revision. So I have an appointment with her October 11th for a one-on-one private consultation. And we're going to discuss my history, whether I can try to continue with the VSG program with her people and see if I can get it stimulated again to kick in with some weight loss, or if possibly I might consider a revision, which is something I said I would never do. However, if Medicare pays for my possible revision if I should choose to go that route. I'll probably consider doing it because, you know, but what I have to discuss with her is that if this medication I'm taking is sabotaging my weight loss, will revision surgery help or will it not? You know, maybe a malabsorption surgery like a DS or a gastric bypass might just give me the boost that I need to lose the next 60 pounds, so that'll put me in the normal range, and I'll have a healthier BMI. So anyway, that's where I am, people. I will be seeing her on the 11th, and I'll let you know what happens. I mean, it's such a long way off, October 11th. I thought I could get in earlier than that, but apparently I can't. But I'm going to talk to her and see what she can offer me, because I really want to try to overcome my problems with this stalling and try to lose some more pounds. So anyway, gotta go. It's 16 minutes here, and I don't even know if it's going to download.